According to the CI World Factbook, by October 31st of this year, the world's population will hit 7 billion. In the U.S., that's 8 babies born and 8 new moms made every minute. With that many new moms, maternity education is important and has many benefits. The benefits of midwifery maternity care include greater maternity education, less medical intervention, and better birth outcomes for mothers and their infants. Maternity education with regards to proper maternity care is essential to providing for the health of the mother and baby, as well as preventing unnecessary medical intervention. Midwifery maternity care has a wide scope that includes a collaborative effort with the practitioner, between women and their practitioners. A woman's needs must be central to this process, thus making her feel comfortable enough with the birth process and to ask questions. This educates her and makes her more proactive and more aware of her decisions when it comes to her maternity care. The woman in the end is ultimately responsible for her care, but her collaborative efforts with her practitioner will provide for a healthier pregnancy and a better outcome. Regardless of the good intentions of medical providers, the medical system in the U.S. has many shortcomings. Poor quality and unacceptable outcomes in healthcare affects more than 4.3 million births annually. Cesarean birth is a common medical procedure in the U.S. This is an enormous expense to taxpayers, providers, and the families themselves. Mrs. Amy Romano, a certified registered nurse, highlights some of the barriers to good maternity education. This was after a study of 650 women, an indication that women did not know or did not understand the risks of cutting their pregnancies short. Secondly, the obstetrical community, which qualifies themselves to be practicing with the best scientific evidence, does not systematically present data to support or contradict commonly used maternity practices. Lastly, proper maternity education is up against unrealistic TV depictions of birth, making it hard to compete with images that are stuck in people's minds. Expectant mothers are naturally avid in obtaining health information when it comes to their pregnancy. They obtain education through childbirth classes, such as the Bradley method, husband-coached childbirth, Lamaze, hypnobirthing, among others, and from their maternity care providers. These sources teach women what their body's normal behaviors are during childbirth and how to work with that process instead of working against it, thus providing promoting better health and preventing unnecessary medical interventions. Many medical birth procedures that were developed to assist women in distress are now being used as a common general practice even among healthy women. Labor inductions and cesarean procedures are among the highest medical procedures performed and billed in the United States. The national cesarean rate rose from 50% between 1997 and 2005, setting a new record each year from 2000 onward. This demonstrates a relaxed feeling by doctors towards childbirth. Available systematic reviews do not support the routine use of common maternity practices such as inductions and cesarean procedures. Most of the interventions pose high risks to low-risk mothers when there are no known benefits towards the health of babies, and developing research indicates a link with early exposure to ill effects later in life. When women obtain maternity education, they will be able to make more informed choices when it comes to suggested medical procedures. Birth procedures used by providers should be in accordance with what the woman's needs are and should not be used as a blanket for maternity care. Midwives are knowledgeable and receive training and credentials that can assist in alleviating unnecessary medical procedures. Their training puts a priority on the most effective methods with the best available evidence-based research to provide the best care with the least harm. Doctors see birth as a medical procedure, while midwives see birth as a natural process for women that should not be intervened unless necessary. There would be better outcomes to the birth process if all medical providers adhere to the natural processes of birth that midwives currently honor, thus alleviating medical procedures that would do more harm than good. For mothers that remain unmedicated during the birthing process, the benefits are large regarding health and for the bonding of the mother and baby. These include pain relief that are brought on due to the mother's production of beta endorphins, the involuntary reflex to push shortly prior to birth, the surge of oxytocin, which activates loving feelings and prevents hemorrhaging, and those benefits continue through nursing. Nisette Jukulevich, the childbirth educator and chair for the Coalition of Improving Maternity Services, shares the benefits of better birth outcomes for women who are cared for by professional midwives, which include fewer hospital admissions during the antepartum period, a lower incidence of hypertension during pregnancy and labor, fewer episodes of abnormal heart rate in labor, less pain for pain medication in labor, including epidural analgesia, a lower incidence of shoulder dystocia in comparison to similar procedures with doctors, a lower rate of instrumental deliveries through use of forceps and vacuum extractors, a lower incidence of retained placenta, and fewer equivalent postpartum hemorrhages, fewer perineal injuries, and fewer third and fourth degree lacerations, and fewer cesarean and more vaginal births after cesarean procedure. With 7 billion people and 8 new babies born every minute, proper midwifery maternity care includes greater maternity education, less medical intervention, and better birth outcomes for mothers and their babies that have far-reaching positive effects.
How would one go about finding childbirth education classes, and which would you recommend?
Childbirth education classes of all kinds are available, as previously mentioned. They can be found through the offices of their providers, as well as Google searches are good ways to find local classes. They range in price, but they're well worth the expense for the peace of mind that you receive. And I would recommend for first-time mothers to take a Bradley husband coach childbirth. It teaches about all the different muscles that the body has and that are used during the birth process, and as well as master relaxation techniques that are helpful in labor. And even if you decide to get some intervention later, you'll be well informed about how the body works.
At what point would you consider a medical intervention necessary?
Medical interventions become necessary when labor doesn't progress. Also, if there are, the fetal heart rate it falls. This usually indicates some larger issues. There was a case where a mother went through a childbirth class and learned everything like she was taught, and she started in labor and wasn't progressing, and it was found out that she had a heart-shaped pelvis and could not push the baby through it. So sometimes medical interventions do have their place when they're used properly and appropriately.